Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss cognitive behavioral therapy, or CBT, and how it relates to managing pain effectively after knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications to catch all of our latest videos related to knee replacement surgery. So, CBT, or cognitive behavioral therapy, is a type of psychotherapy, and it focuses on changing negative thought patterns, negative behaviors, and perceptions. And for our purposes, in relation to pain and what pain can do and its impact on your recovery from knee replacement surgery or in other circumstances. There's some common basic principles of CBT. This includes identifying and challenging disordered or incorrect thoughts. It also relies on developing strategies to cope with these thoughts and cope with pain or whatever issue it might be you're dealing with. Some of the main common techniques include cognitive restructuring, behavioral activation, and relaxation exercises and techniques. And we'll talk about those a little bit more later on in this video. The common important things when it comes to pain management is understand pain perception. The psychological aspects of pain perception include, fear, anxiety, depression, stress. It's a fear of movement, a fear of doing things, a fear that you're always going to feel this way, a fear that you're causing damage or harm to your body anytime you feel pain or stiffness or any symptom. And it's those negative thoughts and emotions that can be incorporated with these and can lead to pain by themselves. We also want to focus on reducing pain sensitivity. We want to alter the perception of pain and reduce pain sensitivity. There's some cognitive and behavioral strategies that we'll focus on to do this. We want to improve your coping skills. So understanding that there's strategies to deal with pain. When you have pain, it's not the end of the world. In many cases, it's part of the normal rehab and recovery process to have pain and discomfort certain times. And so we want to focus on managing that in an effective and appropriate way and looking at different ways to problem solve. For example, if you're having pain with a certain movement activity, how can we alter it? Maybe doing it in a different technique, maybe doing less of a range, less repetitions, less weight or intensity, ways to alter activities and alter things so that you're still performing them and retraining your body and retraining your perception and experience with pain and movement. We want to enhance your pain tolerance. Improve pain tolerance by changing the way you think and respond to pain. Like I said, understand that pain is just your body's alarm system. It doesn't necessarily mean that there's tissue damage or there's injury or trauma being caused. It's basically your body saying, hey, let's be careful, let's watch what we're doing. And what can happen after a surgery or having pain for a long time is that alarm system, that signal can get mixed up. So what I mean by that is things that aren't really causing pain, aren't really causing damage or aren't necessarily harmful or threatening, start to become and maintain pain disproportionate to what you're really doing. So for example, a simple activity like bending your leg, walking, starts to be extremely painful and uncomfortable, but part of that is that perception through having that pain for such a long time. So what we have to do is retrain your nervous system, retrain your muscles and body to understand that you can tolerate and you can cope and manage this pain and this comfort, and you can perform these movements. Your body is much more resilient than your nervous system gives it credit for. So what we want to do is work with a therapist. Find a physical therapist or other therapist who is trained in cognitive behavioral therapy strategies, ways to manage pain, ways to retrain your system, retrain your coping style and your experience and your reaction to pain and other symptoms. Real quick, we'll talk about some of the strategies, three main strategies. One is cognitive restructuring. So how do we identify and challenge negative thoughts related to pain and replace them with more balanced and more realistic and truthful thoughts. Like I was saying, you may have really bad pain and you think, oh my gosh, I'm damaging my knee replacement. I'm damaging my knee. I'm causing more arthritis. I'm going to injure myself and hurt myself. When really we have to go back to pain is that alarm system. Pain is just that little bit of it saying, hey, let's pay attention here. And that alarm system is out of whack right now. So we have to do some behavioral activities. So going to number 2, behavioral activation. We have to engage in activity, engage in movement, doing things that are enjoyable and meaningful to you. Maybe that is walking, hiking, maybe it's standing up and cooking a meal, maybe it's gardening, whatever that may be for you. Engaging in those activities, even though they might cause some pain and discomfort, but understanding that that pain and discomfort is not something to be alarmed about. It's something to engage with and say, okay, it's there, it's present. Now what can I do to continue this activity and retrain my brain, retrain my nervous system to be able to do these activities with less pain and discomfort. And the last part, the third part, is relaxation exercises. So using relaxation techniques such as deep breathing, mindfulness, progressive muscle relaxation can really help to calm down your system, calm down everything that is heightened and hyper alert, calm it down, have a more realistic, more positive response to what your body is feeling and what is it experiencing. So to summarize, we talked about cognitive behavioral therapy, 3 main techniques: cognitive restructuring, behavioral activation, engaging in joyful, meaningful activities physically, and relaxation techniques and exercises. I hope you found this video insightful. Please be sure to reach out to your physical therapist, your healthcare provider, to learn more and get connected with a professional who can take you through some of these techniques and strategies. Again, thank you for watching. Hit that like button, leave your comments and questions below, and have a great day.